And as part of the Affordable Care Act, there are a number of different revenues put on North Carolina workers, North Carolina businesses to pay for. And that is our taxpayer money. It's our taxpayer money, whether it goes to the federal government or the state. It's money that we pay in. By foregoing this Medicaid expansion, what y'all are saying is we're going to have North Carolina taxpayer money pay the federal government go to insure people in Arizona, in Nevada, in Ohio, in North Dakota, all of which, by the way, have Republican governors and are expanding Medicaid. Because they realize it is critical for the economic health of their states as well as the physical health of the people. Senator Brown said, how does this help the economy? Well, I'll tell you how. Because on a gross dollar basis, if you factor in just what does North Carolina have to contribute in Medicaid match over the next 8 years, it's $840 million. All right? What does that draw down? $15.8 billion from the federal government, paid for by North Carolina taxpayers. So you all are rejecting money that we as North Carolina taxpayers pay to the federal government. That's about $16 billion in economic activity. There's been a study done by a consulting firm that analyzed what are the economic impacts of that money. Well, it comes out to about $1.5 billion to the state GDP each year for the next 8 years. I really look forward to what ideas you come up with this session that will result in $1.5 billion in GDP growth to the state of North Carolina. It will result in 23,000 new jobs here in North Carolina. This is money that will go to ensure health care in rural communities. Rural hospitals are genuinely at risk. Once they lose that federal contribution for uncompensated care, which they will, and they have still a large number of uninsured people coming through the door, how are they going to pay for it? Well, either they're going to go out of business or they're going to demand more out of their insured population. That's you and me, those of us who are fortunate enough to have health insurance. That will end up raising your and my premiums approximately $1,000 to pay for that uncompensated care. This is a deal that is good for the economy and good for the people of North Carolina. We have the opportunity to expand the GDP and increase jobs. We have the opportunity to save 2,800 lives a year. Quoting a Harvard study, there was another one that showed when you increase health care insurance coverage, people get more treatment. Or they go to the hospital. And what happens today is either they don't go to the doctor, or when they do go to the doctor, they can't afford the prescription drugs or the treatment necessary to address whatever their health problem is. Well, if we expand access, we are saving North Carolina lives, 2,800 a year. We can leverage $15 billion in federal money paid for by us, you and me. And we can avoid imposing a hidden tax on existing people with health insurance. Let us not miss this opportunity. Let's vote against this legislation.